Why don't we start with some wonderful introductions? Many of you know Lucy, and if you don't know Lucy, I met Lucy when there was a mother's gathering that was happening through our mutual friend Hannah Galata, and we. I think there was somehow it worked out that I was gonna provide some knowledge to a group of women, and we would meet up and have some nice wine and tea and some food and just sit and chat and share knowledge. And we just connected, right, Lucy? It was like this immediate connection. It was so wonderful. And then you moved to Summerland, and we've reconnected now through the Wild Collective. Which is such a wonderful way to kind of stay in touch with great friends, right? So what I wanted to do is have Lucy on today because for many reasons, but one reason is that with everything that is happening in this world, and even before that, women were having a hard time in motherhood, okay? And it might look like on the surface everything is great, but many of us are not doing all that well, and we're not experiencing necessarily the thriving motherhood we thought we would be. And this is from personal experience. With 2 kids, I had a really hard time. So I wanted to invite Lucy. Lucy has this amazing intersection of skills where she's a registered clinical counselor, and a mother of 2 boys, and you'll tell us the age of your 2 lovely boys. I want to leave some information for you to share. And so I thought that she had this unique perspective on giving some insights and then some really practical tips on thriving in motherhood. So hi, Irina. So Lucy, please go ahead and just introduce yourself and what your practice is like.
Patricia. So as most of you know on the call, I'm a registered clinical counsellor, and I've been in practice for, almost about 7 years now with my private practice. Has recently relocated to Summerland mid-pandemic, and I've worked with all types of individuals. I do individual, couple, youth work, adolescents, and it's been a wonderful journey. As Patricia mentioned, I'm a mother of 2. So I have Hendrix, who's almost 3, aka Bam Bam. So you can imagine what our life looks like with him. And he was Bam Bam from the moment he popped out. We were like, oh, okay, what's his nickname going to be? And then Freddie. And Freddie arrived with us 9 months ago. He was born at home, again, mid-pandemic, when we just moved into our new home in Summerland. And it was wonderful. It was a beautiful chaos. But having since had my second child, I have really been sort of humbled, I guess, by the motherhood journey, not only through my own personal experience, but also through my client experience. And I think that this year alone has highlighted some of the struggles that have been present prior to this. Right, I think they've just been sort of magnified, or some of our resources have been taken away from us to even, to be able to cope day to day. So I was thinking about it a little bit, and I'm like, okay, so as mothers, we're sort of, we go through our day-to-day routine, and we're doing okay, right? Like we're surviving. We're getting up, we're managing to get them to school, maybe on time, maybe not so much. We're doing our thing, and then day finishes and we're like, okay, whew, we got through. But in the bigger picture, what kind of life are we creating for ourselves, right? Is it one where we're thriving? And one of the biggest things I've been told, and especially with my second Freddie, who some of you know on this call have been a beautiful support to me. He does not like sleep. And one of the biggest comments I get is like, just, and I might have been guilty of saying it myself, it's like, it's just temporary, right? Just get through. And that's great. We will get through. But I personally want to do it in a way in which I'm thriving, right? I'm living my best life.
So true.
Yeah. So hopefully today, we will today kind of explore a little bit deeper what that looks like.
Oh, Lucy, thank you so much for bringing this up. You know,
Hmm.
it's like this undercurrent in motherhood, I feel like.
Hmm.
And we used to gather as women and share our wisdom and have different levels of knowledge and expertise to kind of have a different outlook and perspective. And now we're really lacking that.
Hmm.
And it's beautiful when women of the same, like in the same life stage, get together and they get to share and they get to, you know, relate their experience. And then we're lacking that like person who has either the training and expertise or
Right.
the life experience at the other end, like, you know, with their children are growing and out and they have this perspective to then reflect back the wisdom, right? So I would love to know from you.
Mhm.
First off, I have a few questions, but my first question is, in your clinical experience, what are you seeing as barriers to thriving in motherhood for the mothers that you're working with?
Right. So a few things here, right? I think the first thing is the level of expectation that we're setting is kind of, for lack of a better word, it's pretty low, right? We're spending time where our thoughts are with others. And I think our focus is natural for a mother, right? Like a natural anxiety comes up in the protection of our child. Um, but there's very little time spent in reflection of ourselves. Actually, I can go straight into my tip number one of thriving in motherhood, because this is such a foundational piece to it, right?
Oh,
Is
yeah.
raising that level of self-awareness. So everyone knows that how do we get through the pandemic? Let's practice self-care, right? How do we get through as a mother? We'll just add in a little bit of self-care. And what does self-care look like? Okay, so we get told to exercise, right? We get told to socialize. We get told to, take a bath. And these are all wonderful things. But if they are not being carried out in a place which is aligned with your needs in that moment, then they're not going to be very helpful. So when we talk about needs, we're talking about your emotional, right, spiritual, physical needs from moment to moment within your day. And when we can raise our level of self-awareness to a point in which we understand what those needs are, then we're rocking it.
Yes, yes.
So I can give you an example here. So, and these are like making conscious decisions, right? Of, what decisions best serve us in our lives. We were talking earlier, the other day, and we were talking about like, okay, how do you raise your level of self-awareness, right? What does it look like to understand what your needs are? So I can give you a few practical pieces. This might be setting a reminder, right, for a self-check-ins. So it might be a reminder on your phone, creating a practice in which you ask yourself, when you get up in the morning, at lunch, go to bed, what is it I need? And then there's apps that can assist you with this too. Some people might know the Calm app or Headspace. I think Insight Timer also sends those little helpful reminders. So the piece that's different for mums here is that we have a really difficult time thinking about ourselves. And to raise your level of self-awareness, you got to think about yourself, right? So I can give you a client example here. Actually, I was working with a client at the very beginning of the pandemic, and she came in as a couple. So I was sitting with the couple, and they said, we've got to work on our relationship. There's so much conflict here. We got to kind of figure this out. And I said, okay. And I really like to understand when couples come into session, what do you both look like individually, right? So in the back of my mind, I'm thinking, how are you showing up for yourself in your life? And how's that reflecting on the relationship? So, focusing on the mother, she proceeded to say, well, like the last 5 years have been crazy. My first son was born really prematurely. She spent many months in hospital. She had a 5-year-old, then the second son was also very sick, or I think it was a really traumatic birth. All right. And she said, so, that was tough, but we're through that now. We made it through. We kind of put the relationship on the back burner. We made it through. Brilliant. That's great. So what did you do, right, to heal from that? And she was like, well, nothing, right? We're out of it. So, okay, so probably pretty depleted from, you know, from the previous years. And I said, you know, what do you look like now, right? What does your support systems look like, for example? How are you day to day? And she said, you know, I'm good. I get through, right? But I don't ask for help because I haven't hit rock bottom. I haven't hit rock bottom.
Oh, poor
So,
soul.
you know, when I hit rock bottom, then I'll ask for help, right? And so that's kind of our level of self-awareness, is that we really aren't even aware of our needs, or for this individual in particularly, it's not even a thought to kind of sit with what that looks like, right? When I hit rock bottom, then I'll ask for help. So, you know, I can't say it enough. I'm here today to tell you that we deserve more. We're worthy of more. And every day should be a day in which we're thriving. Right?
Amen.
So I'm kind of losing track here where I'm going. So that was a client example, right? Of, you know, increasing our self-awareness, right? And what
so how would you, to guide you on that, how would you then what would be a tip for her to raise her level of awareness? So she's sitting in front of you, she's like, I don't know, what does that mean to raise my level of awareness, to become aware of where I'm at, and how someone like you might look at me and say, this is what you need to do, and I can't see it for myself?
Okay, let's see if we can do a little exercise here. Now, when you're to picture you're sitting in a movie theater, and you can do this with your eyes closed. If you guys are engaged, or if you're able to get a little bit more engagement as you're watching live or on the recording, take a moment, sit with your eyes closed if possible, and picture that you're in a movie theater. And these are kind of foreign to us nowadays. We probably don't remember what they look like since the pandemic. This one's open. You're sitting in a chair, and the movie's starting, and it's you. All right, and you're waking up. And whatever you're doing when you wake up, whether you get out of bed, whether you pick up your child, you're brushing your teeth, right? You proceed to get dressed, or maybe not because it's COVID and you're working from home, right? Maybe you put on the kettle, you're feeding the children, you're getting into the car. So this movie is all you running through your day. You come home, right? Back into bed. So now as you sit and watch this movie, and be really intentional with this, when I look at that person in front of me, what do I feel like she needs? So maybe she looks like she needs some more sleep. Maybe she needed an extra 2 minutes in the shower without her child coming in. Maybe she needed to finish the breakfast, right? What is it she needs? So we don't have time today, but what I would ask you to do, if you'd like to, is come back to this exercise if you found it helpful, and replay that movie, right? And replay that narrative of what is it I would do differently if I was truly attending to her needs.
Lucy, thank you for sharing. That is so interesting, because like actually doing it, I had a moment where I was like, oh, I really need, like I needed to step outside for a moment after having breakfast and go for a walk around the block before I came back and started my work, just to get like that break between like the children to the work. Thank you. That was so powerful, because every person's going to have their own needs. And it's not so much that other people have to be telling you what you need. You need to have that. You need to raise that level of awareness to determine what it is that you need. You know those needs best, but you need to be in a place to tune into them, become aware of them. And that's the what. The how kind of comes later. The what is so important to recognize, so you can have an honest conversation with yourself and then your partner and then other people in your life to get that support and not hit rock bottom. And when you spoke to the story of that girl, that woman that you were seeing, that, sister in our sisterhood, I'm so grateful that she had a chance to interact with you and now get that guidance and wisdom that you'll be able to give her, because we should not be thriving. We should not be surviving. We should be thriving. Yeah. Absolutely. Thank you. And so do you have any other amazing tips for us? Because that was brilliant.
Another piece, and some of you that know me quite well, I try and advocate this within the community, which is getting outside, right? Moving our body and getting outside. And again, this is something where people say like, oh, I know I should get outside, right? And I know the sunlight will be good for me. And yeah, exposure to vitamin D, especially now, increases our, immunity, our well-being, and increases our mood. So we kind of have this knowledge floating around. Maybe we've even seen it on Instagram. But how much of it is it a priority in our lives, right? And have we actually experienced the effect of that? So I cannot express. Actually, I can refer to my therapeutic practice too. I offer walk and talk sessions. So rather than being in the therapy room, and this isn't for everyone, right? But rather than being in the therapy room, we go for a walk. And we're blessed in British Columbia, as most of you know, to have amazing scenery and places to go. But and the shift I see in the clients, right, even in their posture, in their voice, the projection, everything is just like, whoo, a bit more alive. So how do we prioritize, right? How do we integrate getting outside into our day? There is a phrase that you coined, and I don't know whether it's from you, but it's habit stacking. And it's something that I have been able to master for many, many years, and I didn't know it was called this. But it's essentially, integrating a habit that you want to, integrate into your day, that you want to practice with other things that you have to do. So this might mean brushing your teeth outside, and then, we're not concerned about what the neighbors say at this point, right? Might be peeling your potatoes, feeding your baby, taking that phone call, whatever opportunity you can get to get outside and making it a priority. Right?
Oh my goodness, that's so good. What a great tip.
Yeah. I actually when I'm reflecting on like client sessions or writing notes or anything like that, I walk and I talk into my recorder whilst I'm pushing the stroller, whilst the baby's napping, right? So I'm working, I'm getting exercise, I'm getting my vitamin D. It's a great way, and my creativity is kind of being lifted up a notch in that sense, and my ability to perceive. One more piece with this, with getting outside, is that it loops to that first tip of increasing your level of self-awareness. To increase your level of self-awareness, you want to be in the present. And when you are outside, your 5 senses are heightened. So sound, vision, smell, taste, touch. If you can bring your attention to those senses, or bring your senses, grounded in that around you, it makes it very more accessible to raise our level of self-awareness in the present.
Oh,
usually,
wow.
We can't let go of the past. Clients say, I can't let go of the past, right? I'm stuck. I can't let go, or I'm worried about the future. So it's a simple piece, stepping out your front door, but it really can be quite transformative.
Oh, thank you so much, Lucy. And I, of course, and it's funny because the habit stacking, it goes so deep sometimes. Like if you just habit stack those two things, then the health benefits, like when the sunlight hits your eyes, it creates the signal to your brain to unleash all of these feel good hormones. And, and as you say, vitamin D is actually a hormone created in our skin, and it needs the sunlight in order to create it. And there's only so much you can get from what you take through your mouth. And yeah, it's like it's a reset. And even if you're in a city, being outside, you get like the connection to like the sky and the light. And especially if you're in somewhere that has trees, like the vitamin green, right? So that spectrum of green hitting your eyes and creating this different cascade. So that was a great tip. Yeah. Amazing. And I can already think like ways, maybe we'll have like dinner on the patio today, and just wear warm clothes, so I'm thinking I'm like already brainstorming, and some people have some really ideas in the comments. And you mentioned that you had 3 tips for to share today. So now I'm like, super stoked for this one. Yeah. It's like, woo,
I could keep going, but we'll stick to 3. So the last one is community. And this one is like, it sews everything together. We are wired for connection. It's indisputable that we are wired for connection, and we were not meant to do this alone. And especially with this past year, how it has been, we have been alone. And I sit with women for hours a day, right, sitting with this loneliness. this sense of loneliness. Right? And it doesn't mean that their partner isn't present. It doesn't mean that the mother-in-law isn't cooking dinner at that moment, but they are lonely in their experience, right? Moment to moment. And, you know, when we're lonely, we're most definitely not thriving, right? And it takes, you know, the saying, it takes a village to raise a child, and it really does, but it also takes a village to raise a human, right? Any human, so a mother. You know, when I think about community, and especially again since COVID, we think about it a lot as in, I mean, the way in which it's accessible is online, right? And it's amazing. I can feel having, you know, being here live and having this beautiful live feed. So thank you so much for commenting, because we have a stream of amazing mothers and they're giving out their, you know, their life energy to us. But that there is a limit, right, to what we, or I think I rephrase that. We should be conscious and mindful about the ways in which we're using social media as a part of our community. So one of the things I notice is we're part of groups. So it might be a mum group or like a group in your hometown or something like that. And we like to post negative experiences in a way in which we're, and actually I see this a lot, like, I just need to vent. I just got to put it out there. And for mums, sometimes it's along the lines of like, my husband just doesn't fold the laundry and he did it again today and I had to cook dinner. And I get it, right? We just want to like, oh my gosh, does anyone else feel me? Right? And then you get this community of like, oh my God, my husband does that too. And it's so annoying. You're like, oh, and then the hit of dopamine, right? Is the likes and the comments. Then it's left. And that's it. And then it's that's it. So it's left. And then people might be scrolling through their feed and it's like, right? And so we're reviewing a negative experience. And that negative experience is then being fed off like you know, ripples in the water to those that view it, right? So it's not to take away from that we don't want to express our experience, but and this is the beauty of therapeutic practice, but you want to do it in a way where you are getting to the underlying issue, the root cause. So you're heard, you're validated, but it's also being understood from that deeper underlying issue and resolved, right? So, you know,
Yes.
does that, I hope that makes sense to everyone. So, you know, when it's held in a space, right, of sharing,
Mm-hmm.
with like a facilitation where it's wisdom, right, and guidance and understanding, and it's sort of delayering, we call it delayering somewhat in therapy is offered, then we're really understanding like what is that really about. So I'll give you a quick example within client sessions, and especially with couples and with mothers. They find it this coming back to this loneliness, right? Like, I feel alone. And one of the struggles I have with my husband or wife or whatever it might be is, you know, that I feel like I do so much. One client especially, she's like, I just, you know, I'm always making the lunches, right? I'm always, you know, booking the doctor's appointments. And her husband was like, but I've offered many times and you haven't let me do it. And when I did, you remade the lunch. And so, okay, so what is this about then? And she said, well, actually, I don't really mind making the lunches and I like having control of the doctor's appointment. But I just wish he would say, I see what you're doing. Can I help in any way? And I appreciate you.
God, right? It's so true.
That's it. So
just teaching him those words too.
Yeah. I appreciate you.
Man,
for any partners listening right now, make sure we're going back to say that to our partners. Yeah, I appreciate you. So
what I'm hearing is that when you have the root cause being not having learned the optimal communication with your partner, so that, you know, them knowing and you knowing, teaching them, or them learning from someone else, the way to, like, the key words and the key expressions that will really like feed you, like nourish you in the way that you need to be supported.
Mm-hmm.
And when you're not getting that, then then there's a tension in the relationship, and then things that would normally not bother you, and then you feel the need to vent, and then there's the venting. Versus that's like the old paradigm, and this new paradigm that I'm sensing that you're getting at, which is having the guidance and the wisdom and the knowledge to share. So you share, and then you get the feedback in a way that promotes growth.
So you're gaining self-insight and understanding, right? And in motherhood as well, we're so kind of busy, right? But we've got a lot on our plates, and we're not giving ourselves the time to really understand. And it's going to cycle all the way back to that first tip, right? Self-awareness of what is actually bothering me here. You know, and then when you have that understanding, what is it I need, and what is it I need? Can my community help me with this? I know I sure as hell have been very, very grateful and fortunate to have such a like, not even supportive is, it doesn't even begin to describe the type of community that I feel that I am part of, right? And humbled and you know, worthy of all the help that I receive, especially over the last 9 months with Freddie. But yeah, so it kind of all comes in that cycle, but community is so key in this journey.
Oh, so key. And you know what I'm going to do is this is like the perfect moment.